Today you can come in the afternoon also, okay?
Yeah.
Today afternoon we'll do one speaking.
Yeah.
Or two speaking sessions.
Okay.
So Dr. Surendra. So we are going to correct your letter, Sally Fletcher. Yes. Sally Fletcher. Right. Yes. Hello and welcome to Seven Sentinels. Hello and welcome to Seven Sentinels. This is Grandmaster class and I am Peter Simon with you. We have subscriptions for OET medicine, writing tasks, reviews, quality review, quintessential quality check. On a regular basis, daily one letter. We have monthly subscriptions. And those who are interested, they can avail this option. And this is a part of classical corrections from Seven Sentinels. Today we have with us Dr. Surendra Muppuraju from Ongole, Andhra Pradesh, India. Hello, Surendra.
Hi, sir.
Yeah. So now this letter is for Mrs. Sally Fletcher. And then, right. The diagnosis is endometriosis. So Mrs. Sally Fletcher, who was diagnosed with endometriosis. Fine. Okay. So discharge plan. So this is a discharge letter. You're now discharging her from the hospital. Don't say, I am discharging Miss Sally Fletcher. Don't say, I am. Don't bring yourself into the picture because that is very, very low quality. Very low quality. Okay, I am writing to discharge. Why you bring yourself into the picture? The hero of the story, or the subject of the story is Sally Fletcher, Mrs. Sally Fletcher. And you are a first-year resident. So first-year resident and surgical ward resident doctor, first year, resident doctor, and a surgical ward. And then this is a 25-year-old woman. Don't write all these long things. See whether their date of birth is given, and you can write the date of birth, and who has recently undergone surgery. So endometriosis, and after that surgery also. Who underwent surgery, or whatever it is. So you can write that, you can write this, but this is the latest. So the latest is the best.
Yeah.
Right, latest development. Fine, that's very good. So she's, you're discharging her from the hospital. You're discharging her from the hospital. You're discharging her from the hospital, not to home. Okay. Okay. So patient to be discharged when can eat, ambulate, and urinate independently. Patient must be discharged to someone who can drive them home. Okay, fine. So you are writing to whom? To doctor, to the GP, patient's GP, known case. So he only sent this patient to you, and you are sending him back. So to Dr. Stevens, Mill Street Surgery, and Mill Street Surgery, Fernham, GU10 1HA. Okay, fine. So now there we start. You are writing to GP, general practitioner. You are writing a letter of discharge to the patient's GP, Dr. Stevens. So general practitioner, Dr. Stevens. Very good. So the name is given. So Dr. Stevens, yes. First this will come. Dr. Stevens, awesome. Dr. Stevens. Okay. Dr. Stevens, you're writing the letter. That's fine. So here, Dr. Stevens. Dr. Surendra, take care, because I'm going to each and every minute aspect, okay?
Okay.
General practitioner, what all the mistakes I'm showing you, they should not be repeated next time. General practitioner, Mill Street Surgery, okay, GP. So GP is a note form, so you have to write general practitioner, then Mill Street Surgery. So it is Mill Street Surgery, absolutely fine. Fernham, okay, Fernham, right? GU10 1HA, GU10 1HA, right? Then the date of discharge. So date of discharge, okay. Discharge plan is here, okay, nothing else, okay. Appointment date is here. Date of birth is here. Appointment date is here. Appointment date, endometriosis. And where is the date of surgery is here? So recovery. So more than endometriosis, who was diagnosed with endometriosis, now recovering post-operative, so recuperating. Not only underwent surgery, but also recuperating surgery without any complications. Okay. So I told you, diagnosis stage, underwent surgery stage, and after surgery stage. Pre-surgery is a diagnosis, post-surgery is recuperating stage. So the most important thing has come. So this is the focus now. Recuperating stage. I hope you understand, right?
Yes.
So then where is the date of discharge? Okay, today's date is, where is today's date? Nothing is given. Nothing is given. So you can write today's date. Showering is permitted. Okay. So any date, that is not a problem, but the date should be somewhere after surgery. So surgery is 25/3. Okay. 25/3 is the surgery, and showering is permitted 26/3. So mobility post-operative, okay, fine. So driving can be resumed, okay, fine. Okay, fine. So now let us see here. So this is 25 is appointment date, and 25 itself is the surgery.
And 25 itself is the discharge date also.
Discharge
Because
also on the same date. Okay, fine.
Because it's a
So fine.
laparoscopic surgery.
Right. So 25 March 2018. That's absolutely fine. Dear Dr. Stevens, your D is this D is okay, but this D is looking like O. So be
Okay.
careful. Be careful. You can write a little bit like like this. So like this, number 1, and you can just do like this, a little inside. Okay. So that will be very clear for you. Okay.
Okay.
So this is the way how you can write D, no problem, little bit outside. So
Okay.
no confusion. So this D is a little bit problem. Okay, it looks like O. So next one, regarding your dots in the column. Here it is okay. Here it is clear, but here it is not clear. You are doing like a hen peck, you know, just pecking at something, you know, like that one. No, it should be little
Okay.
clear, like this one,
Okay.
better. And DOB, B should join the line. B should,
Okay.
better B should join the line. Okay. Like that. And like that. You understand now?
Yeah.
It should join the line. You are cutting off in between only. There is no, be careful that one also. Then next one, date of birth, 3 October 1993. That's fine. October. Yes. So let me help you out with that. Yeah, here it is. Forgot that one. So Dr. Stevens, then GP, Mill Street Surgery, Farnham, GU. Okay, fine. Now this is a discharge letter. So we'll see that one later. Next one is the date. The date is the same date. Okay. So date of admission, appointment for surgery. That is not admission date, appointment for surgery. So direct surgery and released. So next one, diagnosis is endometriosis, number 1, and surgery also finished. Then recovering also going on, excellent recovery immediately. So no complication, uncomplicated. So unremarkable. The condition was unremarkable. So she's being discharged on the same date. Okay. And then fine. That's clear. And Dr. Stevens. So that you will take from here. Dear Dr. Stevens, just add dear to Dr. Stevens' second name. And next one, we don't know the first name. Mrs. Sally Fletcher, who underwent laparoscopic surgery for endometrial cyst. So here you can say better, Mrs. Sally Fletcher, who has been recuperating.
Who has been
after laparoscopic surgery for endometrial cyst.
Who has
Okay.
been recuperating.
So I am writing here.
Okay.
Who has been recuperating after. Okay. So it is not surgery. It's not just surgery. She is already recuperating. That means recovery stage. Okay. After surgery, you cannot discharge them. Okay. Immediately. So she is recovering. That is more important, you can say. So instead of this one, so underwent, this is just finished stage. This is one stage before you are talking. Okay. The present status is recuperating status.
Yeah.
Diagnosis, then she was admitted, then she was first diagnosed, then admitted, then surgery, then recovering. Okay.
Yeah.
So you are one stage behind. Okay.
Yeah.
The latest development should come forward. Okay.
Okay.
So Mrs. Sally Fletcher, who has been recuperating after laparoscopic surgery. Don't say a laparoscopic surgery. Surgery, you should not use article because it is uncountable. So laparoscopic, see your A and O look alike. Very good. You are your level of letters are same. In the beginning, it is fine. Then afterwards, you got habituated. See, in the later stages, they're not perfect again. Okay.
Yeah.
Laparoscopic for surgery. Two 50. Yeah. Laparoscopic surgery for endometrial cyst. What do you say? Laparoscopic surgery for endometrial cyst or for the removal of endometrial cyst? What do you say?
For the removal of endometrial cyst.
That is missing, no?
Yeah.
It is laparoscopic surgery for Mrs. Sally Fletcher, but not for endometrial cyst, right?
Yeah.
You understand?
Yes.
Quality. If you write like this, you will get A grade. Okay. I told you
Yeah.
already, I'm going deeper into the subject. Okay.
Yeah.
So till now
So-
is one level, and from now it will be another level, a second higher level. So Miss
Okay.
Sally Fletcher, who has been recuperating after laparoscopic surgery, is for Mrs. Sally Fletcher, not for endometrial cyst. Okay.
Okay. Is for.
So when you wrote for endometrial cyst, that means endometrial cyst has some problem, and you operated endometrial cyst. You did not operate endometrial cyst. You operated Mrs. Sally Fletcher. You understand?
Yes.
For removing endometrial cyst. You did not do any surgery for endometrial cyst. You did not do surgery for endometrial. You did surgery to Mrs. Sally Fletcher for the removal of endometrial cyst. You understand?
Yeah. Yeah.
Is that quite clear, dear?
Yes. Yes.
Be very, you have to have that microscopic lens, okay?
Okay. So Mrs. Sally Fletcher, who has
For
been
the removal of
recuperated.
endometrial cyst.
Yeah, Miss Sally Fletcher, who has been
I
recuperating
don't think
after laparoscopic surgery.
you can give a little more time, na, today.
Yeah.
Okay, fine. Because I'm going deeper, because I don't want to correct like this every day. So today, if
Yeah.
I give you perfectly, then next time you will be very careful. For the removal of endometrial cyst.
Okay.
See, how can you say surgery for endometrial cyst? There is no
Yeah,
question, no question. There is no meaning in that.
Yeah.
So who has been recuperating after laparoscopic surgery for the removal of endometrial cyst?
Okay.
Okay. Requires ongoing monitoring and appropriate management. Okay, let us see that. So patient to be discharged. Okay, patient must be discharged. Okay, independently. Medication in progress. Nursing management. Okay, so management should be continued. Okay, fine. Next one is relationship. Okay, then so he will be supervising his progress, her progress, right?
Yeah.
So
Yeah.
fine, right. So this is coming small. Okay, what you can do is next time when you're sending, you send the notes separately and this one separately with Microsoft Lens. Okay, because of the text and this one, they are different dimensions. No, that's why the
Okay.
picture is getting one small, one big like that. See,
Okay.
take the full picture, no full page picture. Why do you want to take small page picture? You
Yeah.
understand?
Okay. Yeah.
Take
Yeah.
the full page so that everything will be same. When you are taking small picture and big picture, the big picture is cut down to minimized. See, I'll show you what is happening. You understand?
Yeah.
One is big and one is small. When you're taking half page, the other dimension is getting reduced. Okay, right?
Yeah.
So that's why I'm getting. So take Microsoft Lens and take the full picture page. No problem, na?
Okay.
Take the full page image.
Okay.
Okay. So that's why I'm getting little difficulty here. Yeah. 250. Yeah. So laparoscopic surgery for the removal of endometrial cyst. Wonderful. Mrs. Sally Fletcher requires ongoing monitoring and appropriate management following the discharge back home. That's all.
Okay. Back home.
No, the home. Back home.
Okay.
Back
Okay.
home. Home is unique. His own home.
Okay.
That's understood very clearly.
Okay.
Back to the house, but not home. Home, no to.
Okay.
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 Don't
Back
use
to.
to with home. I
Okay.
went
Back.
home. That's all. I went home.
Okay.
Home will not take a preposition. Okay.
Okay.
I told him. Told will not take a preposition. I told to him is wrong.
Okay.
I said to him, but I told him. Finished? I questioned him. I questioned him. Finish. I questioned to him is wrong. You got it?
Yeah.
So discharge back home. So this is not right.
Yeah. Or we can write back to the house.
No need house. The house is not a good word here.
Okay.
Home means place of living. House means maybe anything.
Okay.
Okay.
Yeah.
Right. Back home. House means the building. Okay.
Okay.
House means only the building.
Okay.
Home means everything included. Family, everything included.
Yeah.
Homely atmosphere, we say. You understand?
Yes. Yes.
Home is an extended meaning.
Okay.
House is just a building, construction.
Okay.
Home is everything,
Okay.
including everything. So be careful. So today, Mrs. Fletcher was presented with painful periods for the past 3 years, for which self-prescribed, hyphenated,
Okay.
hyphen,
Okay.
self-prescribed, self-prescribed. So self-prescribed. Today, Mrs. Fletcher was presented with painful periods. She was presented with painful periods for the past 3 years, or presented with the complaints of painful periods. Okay.
Presented, I think so.
For which self-prescribed with
Naproxen.
for which naproxen, for which self-prescribed with naproxen, but the pain persisted. Okay, 3 years, full stop you can put here.
Okay.
Mrs. Fletcher was presented with painful periods for the past 3 years. Okay.
Okay.
Which was self-treated with naproxen, not self-prescribed. How can she prescribe? Yeah.
Yeah. Okay. Okay. Self-treated.
She's not a doctor to prescribe, right?
Okay.
What are you writing here? How can she prescribe for herself? Is she a doctor? Okay. Only a doctor can prescribe to himself, not anybody else. You understand?
Okay.
Prescription, writing prescription is the sole right of the doctor, not anybody else. Okay.
Okay.
Right. So just with this word, be careful, because it's only a doctor's power. Okay. For which was a self-treated with naproxen. Okay.
Okay.
Fine, but the pain persisted. Very good. An ultrasound revealed 6 centimeter cyst. A 6 centimeter cyst. Okay.
Okay.
A cyst or more cysts? Tell me, singular or plural?
One cyst. One cyst.
So you have to write A there, no?
Okay.
A cyst.
Yeah. Yeah.
A cyst which was 6 centimeters. You understand?
Yeah.
A 6 centimeter cyst.
Yeah.
In the abdomen. A 6 centimeter abdominal cyst.
A 6 centimeter abdominal cyst.
Abdominal, in the abdomen is not needed now. Abdominal cyst means a cyst in the abdomen.
Okay.
You understand?
Yeah.
You can
Ultrasound
eliminate
revealed,
these 2 words in the.
Yeah. Yeah. An ultrasound revealed a 6
This is correct
centimeter
only. No
abdominal
doubt
cyst.
this is correct.
Okay. Okay.
Abdominal cyst. Hence,
Okay.
comma, A laparoscopic surgery. Why do you write A with surgery? I told just now you should not use, right?
Yeah.
Okay.
Yeah.
A laparoscopic surgery was performed with a laparoscopic surgery, which was unremarkable, was performed.
Which was unremarkable.
Was performed. A laparoscopic surgery, comma, which was performed, comma, was unremarkable. Okay, I'll write. I don't know what you're going to write there. Laparoscopic, hence, laparoscopic surgery, which was performed. No, it doesn't suit here. Hence, laparoscopic surgery was performed and it was unremarkable. Or remove hence and say laparoscopic surgery, which was performed, was unremarkable.
Okay.
Yeah. No need to say hence here.
Okay.
So if you say hence, the meaning will be deferred.
Okay.
Laparoscopic surgery, which was performed, was unremarkable. Is that clear?
Yeah.
Okay. Or you can say, hence, a laparoscopic surgery was performed and it was unremarkable.
Okay.
Okay.
Hence, laparoscopic
You
surgery
cannot
was
perform an unremarkable surgery.
Okay.
Okay, you can perform a surgery and it will be unremarkable, but you cannot perform an unremarkable surgery. You understand?
Yes.
Be careful when you are using words. Then
Yeah.
next one. Mrs. Fletcher was advised to keep incision site. The incision, the only one site is there, right?
Yeah.
So the incision, a particular one.
Yeah. Okay.
The incision site. Mr. Fletcher was advised to keep the incision site clean and dry. Why do you want to write Miss Fletcher again, Mrs. Fletcher again and again? I don't know who is teaching every time to write this Mrs. Fletcher in every paragraph. I don't understand. What is the need? Because the main subject itself is Mrs. Fletcher. Okay, no need to write every time. Not necessary. Okay. Education was provided to keep, maintain the. What is this keep? Yeah. What is the ordinary word?
Okay.
Huh? Very ordinary word. Very basic word. I don't know. I want to teach you the difference between the basic words and the super special words. Okay. Keep. What is the level? Even a LKG students can say, okay, not LKG, first class, second class student can say keep. To have or continue to have in your possession. You understand now? It is
Yes.
A2 level. A2. A2 level means what? Your score will be 250 to 300. A1 level means below 250. Okay.
Okay.
Then A2 means 250 to 300. B1 means 300 to 350. B2 means 350 to, okay, no, 350 B2. C1 is 350 to 400 and above. And C2 is 450 and above. You understand now?
Yeah.
So now you can use the word maintain. Now see this power, B2. Now you understand B2.
Yeah.
Very powerful word. Why don't you use, if you use this maintain, at least you will get 350. For this word, I mean.
Okay.
If you use A2 level words only everywhere, you will get 250 marks. If you use B2 level grade, you'll get 350. If you use C2 level words, you'll get 450. You understand now?
Yeah.
A2, B2, C2. 250, 350, 450. Now you understand?
Yes.
So target C2 words.
Okay.
Okay. So now I'll show you whenever. Okay. Education was, I don't want to write this one. Okay. I'll write a different sentence. Okay. Are you ready to learn something new?
Yes. I'm ready.
Education for maintaining the incision site. Clean and dry. So education was provided. Education was provided. You got it now?
Yeah.
Okay, necessary education. Okay.
Yeah.
Necessary education was provided. Okay.
For
For maintaining the incision site clean and dry. Don't you see the difference?
Yes, yes. I can see.
For whom? Only one pay. Oh, who? Again, somebody else is coming. Mrs. Fletcher. Mrs. Samsung is coming or Mrs. Lenovo is coming. No, no.
Yeah.
Only Mrs. Fletcher. You know that is only one patient, correct?
Yes.
Then why do you bother about it?
Okay.
Okay. So I need not tell every time, Mr. Muppuraju, Mr. Muppuraju, Mr. Why nonsense? Only one Mr. Muppuraju is there. Okay. There may be many people in the YouTube watching. That is not my problem, right?
Yeah.
There is only one patient for me. That is Mr. Muppuraju, who is my patient. I'm the doctor. I'm a language doctor. You have some problem, right? I'm doing open heart surgery.
Yes.
I'm removing your endometrial cyst. Okay. You understand? You are my patient and I'm your doctor. You have some medical problem. That lady has a medical problem, but you have language problem. You understand?
Yeah. Yeah.
You understand what I'm relating to?
Yes, yes.
So you are only one patient. Why should I tell every time Mr. Muppuraju, Mr. Muppuraju? I don't need to say that one because only one Muppuraju is that on the other side of the screen and only one Mr. Peter is on this side of the screen. So why should I take you also is not necessary. Is that clear?
Yeah.
What is more important? I am not more important. You are not more important. The subject, that means your letter is more important here, right?
Yes.
So let us focus on the problem. What is the problem here? Education is important, not Mrs. Fletcher. Mrs. Fletcher is not at all important here in this sentence.
Okay.
Mrs. Fletcher is the emperor of the letter itself. Why are you degrading the level of emperor to an ordinary king of the sentence? You understand?
Yes.
You call the Prime Minister of India and ask him to ask him to do the job of the Chief Minister of Andhra Pradesh or some other state. How it will be like? You understand? Then who will rule India? You got it?
Yeah.
The entire country is ruled by Prime Minister. In the same way, Mrs. Fletcher is the Prime Minister of this complete letter. You understand?
Yes.
Don't degrade Mrs. Fletcher and pull him down to an ordinary soldier.
Okay.
Essay, then paragraph, then sentence. Sentence is very small thing. And everywhere you are putting Mrs. Fletcher, Mrs. Fletcher, Mrs. Fletcher. You are making a nonsense of Mrs. Fletcher. And for this sentence, education is important, not Mrs. Fletcher, right?
Yes.
So you see here, education is important. So Mrs. Fletcher was advised to keep the inside. For advice, what is, you can say necessary education. So that is important. So bring there, that is make it the king of that sentence. Okay.
Okay.
I'm going deep, huh?
Yeah, yeah.
I don't know how you are going to take. If your brain blasts also, that is not my problem. That's your problem. Okay. Mrs. Fletcher was advised to remove this and finish. In addition, what do you mean by in addition? Is it one word? Is there anything word like in addition in the dictionary?
I mean,
or is it two words? Don't you know the words, the difference between one word and two words? Huh? How come you can do like this injustice to English? Tell me. You're a doctor, not a specialist in English, no doubt. But in addition is two words, right? Yes or no?
Yes, yes.
Are you getting angry with me because I'm telling all these things?
No, no, no.
In addition, analgesics were prescribed. Very good. Very good. Analgesics is the king of this sentence. Analgesics were prescribed and driving was restricted.
Okay. Driving was restricted. Okay.
Okay.
Yeah.
Driving
Was
restricted. You got it?
Yeah.
Analgesics were prescribed. That's finished. Driving was restricted. Now you understand?
Yes, yes.
Restricted driving means I restricted driving. And why this restrict present tense? Why present tense you used? It's past tense. Why did you say restricted? Driving
Okay.
was restricted. Turn top,
Okay.
left, right. Change the
Okay.
places.
Okay.
Driving was restricted.
While taking medications.
Driving was restricted. Okay. Driving was restricted while taking medication. What do you mean by while taking medication? That means at the time he is taking medication, or
Yeah. I mean,
during
while
the
on,
entire period, na?
yeah, while on medications.
Huh?
While on medications.
During the entire period when he is taking the course of medication, right?
Yeah.
So be very clear, na? Be very clear.
Okay. Okay.
Refraining from driving is suggested. Okay. During the entire period while he is on the course of medication. Okay.
Can you repeat it?
Is recommended. Okay, fine. So driving was restricted. Okay. While taking, not while taking medication. Now I am taking with this minute. That time I am driving is restricted. That means stop and afterwards take medication, then again drive. How can it be? You understand?
Yeah.
There's some sort of confusion also, right?
Yeah. Driving was restricted
during the entire period while he is on the course of medication. Refraining from driving is recommended. You understand? For the entire period while he is on medication. You understand?
Yeah.
Maybe 1 month or 2 months or whatever, right?
Yeah.
So driving can be resumed after 20. So after 20. So again you are telling this thing. What do you mean by this? Again it is the same thing you are telling, na? That means post a period he can resume. That is what it is. Use that sentence or this sentence. Why are you using both the sentences?
Okay.
Today you don't go anywhere. That means automatically tomorrow you can go, no?
Yeah.
Then why again? Today you don't go anywhere. Tomorrow you can go. Why nonsense it is? You understand? You are repeating the same concept. Words you are changing, but the same thing you are repeating there.
Okay.
Resumption of driving after 24 to 48 hours post medication period is recommended.
Okay.
You understand?
Yeah.
Is that clear?
Yes.
Resumption of driving. Okay.
Yeah.
Is recommended only after 24 to 48 hours after. Something not clarity here. Let me check. Yeah. Okay. Driving can be resumed after 24 to 48 hours after final dose of analgesics. You understand?
Yeah.
Is that clear? That should be very clear.
Yeah.
Okay. Resumption. Okay. Resumption of driving. Okay. Or driving is refraining from driving or avoiding driving, or driving is prohibited. Driving should be avoided. Okay. Anyway, you can write.
Yeah.
Okay. Before the completion of 24 to 48 years after the ultimate dose of analgesics.
Okay.
Okay.
Yeah.
Is that clear?
Yeah.
So if you want to write, you can go to my video in the YouTube. Then afterwards you take. I cannot write everything now. Okay. You can take it from there, from the YouTube afterwards. Okay.
Yeah. Okay.
No worry, because I have already recorded everything. You can take it from there. Huh?
Yeah. Okay.
You can repeat and write. No problem. So
yeah. Okay.
refraining from driving is recommended. Avoiding driving is suggested. Okay. Driving can be, you can use that sentence or this sentence. This is a repeated sentence. There is no meaning. You said driving is restricted, and here you are saying driving should be resumed. There is no meaning.
Yeah. Okay.
It says, do not consume alcohol for 2 months. That means after 2 months you can consume, no?
Yeah.
So the same thing you are writing in a different style. That's all. This is a repetition of the same concept what you have told earlier. Is that clear?
Yeah.
So Mrs. Fletcher, Mrs. Fletcher can resume her normal diet. Normal diet can be resumed. Why Mrs. Fletcher again?
Yeah.
Okay. Normal diet can be resumed.
Yeah.
Consumption of plenty, consumption of abundant fluid, abundant amounts of fluid consumption is encouraged. Is that clear? I'm sorry,
Yeah.
I cannot write everything. Okay.
Yeah.
Encouraged to consume the active voice.
Yeah.
Mrs. Fletcher can resume her normal diet. Active voice.
Yeah. Normal
Still you are using active voice. I don't know why. Normal, normal, regular. Okay.
Okay. Regular date can be resumed.
Can be resumed.
Okay.
Okay. The next one. Abundant amounts of increased consumption. Okay. So consumption of fluids. Okay.
Yeah.
Aside. What is this aside?
Aside from.
There is nothing called aside from. Aside means by the side of, not from.
Okay.
Aside means by the side of.
Okay.
It's like beside.
Yeah. Okay.
Actually, this aside from is not there. Besides means besides this one. No, there is no asides. Like, okay, this is a wrong usage. Okay.
Okay.
Consumption of plenty, abundant amounts of fluid consumption, abundant amount. No way. In higher quantities. Okay. Higher quantities of fluid consumption is encouraged. Okay.
Higher quantity of fluid consumption is encouraged.
Higher quantities of a fluid consumption is encouraged.
Okay.
Higher quantities are encouraged. Higher quantity is encouraged, or higher quantities or abundant amounts of a fluid consumption is encouraged.
Okay.
Okay. As much from walking asthma. In addition to, okay. In addition to walking according to the tolerance, as much as she can, according to tolerance. You understand now?
Yeah.
Walking for tolerable distances.
Okay, walking for tolerable distances.
Or walking according to tolerance. Capacity to tolerate. See, as much as she can. See, 5 words, right?
Yeah.
So reduce, na? Reduce.
Yeah.
Tolerance is a good word.
Okay.
As much as she can. There is nothing in as much as she can. 5 words.
Okay.
Low quality, 5 words.
Okay.
So tolerance, what level is that word tolerance? Let us see. Tolerance. Tolerance is C2. Now you understand?
Yeah.
Can you see what is C2?
Yeah.
These words will push you to, you say lifter to C. C2 words will lift you to 450 marks.
Okay.
I don't know whether you know this one. C2. Okay. CEFR levels and OET. CEFR levels and OET. See here. Now, can you see this C2?
Yeah.
Now, can you see C2 level words, CFR band?
Yes.
You understand now?
Yes, yes.
It will take you to A grade in OET, okay?
Yeah, yeah.
And you are using B2 level words, not even B2, they are A1. What you have said, written, as much as you can, or B2.
Okay.
Now, at least the tolerance is C2, at least one word is C2 level. You understand now?
Yes, yes.
So, now if you take the word as much as you can, see the word as. What is as? As is A2. You understand now? Okay.
Yes, yes.
Much. Much is A1. Then can. Can is A1. Now you understand what is the quality of as much as you can.
Okay.
But
Understand.
as much as you can, if you take as a full thing, as much as you can. Okay, that is a different saying. As much as you can. Okay, that's a different concept. Is that clear?
Yeah.
So that's fine, but not very excellent. Okay, tolerance is C2. Is that clear?
Yes, yes.
Okay, fine. So use better words. That is what I mean. Next one.
Yeah.
Based on the aforementioned circumstance or circumstances.
Circumstances, sorry.
Plural. Okay.
Yeah, yeah.
Based on the aforementioned
Aforementioned
circumstances, comma, based on the aforementioned circumstances, requires further monitoring and appropriate treatment are required. Would be why requires here? I don't understand why you wrote the word requires. There is no need for this word requires.
Okay.
Okay, right? There is no need. Further monitoring and appropriate treatment would be profoundly beneficial. We know Mrs. Sally Fletcher. Why do you want to write again Mrs. Fletcher?
Okay.
Further monitoring and appropriate treatment would be profoundly beneficial.
Okay.
Okay. In
Yeah.
case any additional information is required, please do not hesitate to contact me. That's fine. That's fine. Yours sincerely. Why this line has come inside? You should start from here. Nah?
Yeah, yeah, yeah.
You should start from the first dot here. Okay.
Yeah, yeah. Yeah, yeah.
Why are you pushing it in? Yours
Yeah, yeah.
sincerely. You are not the only first year resident, my dear. There will be many first year residents like you. Okay.
Yeah.
Many first year resident doctors will be there. Okay.
Yeah, yeah.
First year resident doctor. Okay. First year resident surgical ward. Yeah. Fairbanks Hospital. 1001 Noble. Noble. What is the spelling there?
NOBLE.
We have to check. Now, sometimes that spelling will be there. Sometimes this spelling. Name of a person. Maybe there. Name of a quality will be there.
We can see up. We can see up in the first line, not here.
You are a first year resident in a surgery. So first year resident, okay. Surgical ward. Surgical ward, that's right. Okay. Fairbanks Hospital, right. 1001 Noble, NOBLE, yeah. Noble Street. Okay, Fairbanks. AK, what is this AK? AK stands for what? I also don't have any idea. AK stands for what? You should know because you are going to Australia. This an exam is that one. Okay. So
Yeah.
let us see that. What is AK stands for? Australian Territory. AK. AK. Australian Territory. AK stands for what? Okay. New South Wales QLD SA TAS VICWA ACT JBT DMT. No, nothing is given there. Okay. right? So that's, if you know that one, that would be better. Otherwise, no problem. Otherwise, no problem. AK stands for what? Let us see that. AK abbreviation. Alaska, and that is in USA. This is USA. Okay. What are the 40 states in Australia? So, yeah, these are okay. We don't want to go deep into that one. So, if you don't know, you can leave it.
Okay.
That's fine. AK 99. Fairbanks. 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 Location. Fairbanks, Alaska. Yeah, you got it now.
Yeah.
Fairbanks is in Alaska.
Yeah.
Okay, so we got it. I was thinking that maybe he's pointing out there only. AK stands for Alaska. Okay.
Yeah.
So Alaska, that's fit. Where is Alaska? Alaska. Yeah. Alaska is in the US. Okay. So he's given that address. No problem.
Yeah.
Alaska,
Okay.
part of USA or Canada. Now you understand?
Yeah.
So that is Alaska. Okay, fine. So Alaska 99701. If we know, we can write. Otherwise, just write like that. Okay.
Yeah. Okay.
So that's fine. No problem. Is that clear?
Yes.
And whenever you are writing from letter next time onwards, you have plenty of time just to take some 10-15 minutes and type that one so that I can give you. Okay. Otherwise, I have to send it to my assistant who has to type and send it to me. Now I'm sending it. No problem. Okay. Next time you can do that favor for me.
Yeah, sure.
Okay. So afternoon, maybe 3 o'clock or sometime like, just ping me. Okay.
Yeah. Okay.
So I'll schedule for the quality
Speaking
check with you. Okay.
Yeah. Okay.
And speaking also. Speaking I'll schedule then, and afterwards I'll schedule some other thing for you.
Yeah. Okay.
So first quality check.
Okay.
Right. This is round A.
Yeah.
Okay, dear. Take care. Bye-bye.
Bye, sir.
And what is the improvement you noticed here? Can you tell me?
Grammar mistakes and how to write the purpose line and quality of the sentences.
Okay, fine. What all I have given you the points, you can just improve in those areas. Okay.
Okay.
And I think you have to write a little more. Okay.
Yeah. Okay.
So your question paper will be valued only from word count will be counted only from here. Okay.
Okay.
Word count will be only from here. So from here. Sorry.
Yeah.
Only from here.
Okay.
Okay.
Yeah.
And your word count will end here only.
Yeah.
Okay.
Yeah.
So I don't think it is 180 words. Okay.
Okay. Yeah.
I don't think there are 180 words there. So you have to go at least till here.
Okay.
Better 200, 210 like that. No problem. Okay.
Okay. Okay.
This should end. This should come. This pointer should come here.
Okay.
Okay. Then remaining can go down. Okay.
Okay. Yeah. Okay.
So then it will be better for you.
Yeah. Okay.
Otherwise, word count will be a little. They will just analyze and then they'll say, okay, till here only has written. So word count is last. So you'll lose 20 to 30 marks. Okay.
Okay.
Right. Okay then. Take care. Bye bye.
Thank you, sir.
So what I want your recommendation. Okay. So for example, any new student is there. You are now an old student of mine. So for example, they may require some suggestion. So there are many people watching this live session later on the YouTube. So what is your suggestion for those future students? Maybe they'll be motivated, and they'll definitely ask me. So before coming to me, I want your suggestion to them. Can you give a few words?
Yeah. Actually, the way you correct was excellent, and the way you go into the deep of the letter corrections, I think no one corrects like this, that deep. So if you follow, if they follows your suggestions, they will get nice marks.
Right. Okay, thank you very much. And today,
Okay.
3 o'clock, we'll meet again. 3 o'clock, we'll meet again for your speaking session live. Okay, the first speaking session will be taken for you. And
Okay.
the first speaking session from the card. What is the first speaking session? You send me a message, I'll send you. Okay.
Yeah. Okay.
First speaking session. Okay, very good. I'm proud of you. Really, I'm really proud of you. You're doing well and you're improving. Definitely. Thank you very much. Have a nice